Hi, my name is Ivy and I'll be presenting a business proposal for the opening of the new Azusa Regional Medical Center Diabetic and Wound Care Clinic. Azusa Regional Medical Center has identified the need to address some issues within the inpatient setting. AZRMC provides care to many patients and many of them have type 2 diabetes mellitus. The patients are generally over the age of 50 and have poorly controlled diabetes. Recently, the average daily census has increased in the number of type 2 diabetes mellitus patients. An increase in the rate of readmissions within 30 days for these patients has increased from 11% to 18% within the last year. Additionally, less patients are reporting that they feel adequately prepared to care for themselves at home. Because of these issues, it has been decided that a hospital-based outpatient clinic will be opened in order to better meet the needs of these patients. The clinic will not only address the needs of these patients, but any patients with diabetes mellitus, including type 1, as they do experience complications of poorly controlled blood glucose as well. Other patients identified who need wound care will also be taken care of in this clinic. There are benefits to opening the Diabetic and Wound Care Clinic, which include improved patient care and outcomes for diabetic patients. Outpatient care is less costly than inpatient care, especially for those who are readmitted or may possibly require admission to the intensive care unit. Education will be better provided in the clinic as providers and nurses have more time to spend with patients, are more familiar with their needs, and are better able to address them individually. Ideally, these patients will then have improved glucose control and better wound care. Currently, these patients require hospitalization because of their poor glucose control and/or non-healing ulcers. They're admitted to any available bed, and no one is specialized in the care of these patients. 2 wound care nurses provide consultation for these patients, with almost half of the average daily census requiring wound care, resulting in patients waiting 1 to 2 days for a consult. Inpatient nurses may or may not complete orders for wound care protocols. Now, with a clinic devoted to these patients, the burden will be offloaded from the wound care nurses and care of these patients will take place in the outpatient setting. The proposed Diabetic and Wound Care Clinic will take some time to implement, as it will be a new outpatient clinic that is going to be opened. After identification of space and location, design changes will need to be made. This process may take up to 4 months. Purchasing of medical supplies and equipment as well as capital purchases will also need to take place. These may take up to 2 months. Concurrently, hiring will take place 4 months prior to opening the clinic, as it will take time to recruit staff, conduct interviews, and clear background checks. The projected opening date of the clinic will be August 2020. Key cost considerations of this outpatient clinic are additional staff, medical equipment, appropriate workspace, utilities, and maintenance. 3 different categories of expected costs are salaries, other costs such as medical supplies, office supplies, maintenance, and capital expenses. Expected revenue sources will include Medicare, Medi-Cal, private insurance, self-pay, as well as funding from AZRMC. Benefits of the proposed plan are improved patient care and patient outcomes. The outpatient clinic will see an approximate average of 375 patients per month. The percentages of those covered by private insurance is 54%, which is approximately 202 patients. Medicare covers 11% of patients for a total of 41 patients. Medi-Cal covers 26% of patients, which is a total of 97. Self-pay is 7%, which is a total of 26 patients. Private insurance will reimburse up to $315 per visit for a total of $63,630 per month. Medicare will reimburse $1,713 per patient for a total of $56,529 per month. Medi-Cal will reimburse $23 per visit for a total of $11,266 per month. Self-pay patients will generate $150 per visit for a total of $3,900. AZRMC will provide $200,000 for the fiscal year. The total operating revenue will be $1,823,900. Staff are required for the clinic to be operational, which will include 1 nurse practitioner, 2 registered nurses, and 1 medical technician. The proposed budget includes the following annual salaries: one nurse practitioner at $132,000, one registered nurse, two registered nurses at $70,000, and one medical technician at $25,000. The annual benefit cost for these employees is a total of $128,700, which is calculated at a rate of 30% of the annual salaries. The rate of Social Security taxes is 6.2%, and the rate of Medicare taxes is 1.45%. The total salary cost, including benefits and Social Security and Medicare taxes, will be $408,816. Other costs are also included in the first year of the clinic, which include medical supplies, office supplies, and maintenance. The budget for medical supplies will be $8,000 for the first month, which will decrease to $5,000 every other month, as supplies will likely only need to be restocked after the first few months and will allow management to see how much is needed. Medical supplies include the following: gauze, swabs, antiseptic, tape, paper rolls, gowns, towels, shears. Office supplies include pens, markers, paper, folders, tape, staples, phones, chairs, staplers. In addition, for the first year of the clinic, capital expenses will be higher as the operation will require equipment. 4 examination tables and 2 vital signs machines are included as capital expenses. The examination tables cost $1,550 each for a total of $6,200. The two vital signs machines are $1,000 each for a total of $2,000. The total for the capital expenses is $8,200. This budget includes anticipated operating revenue, anticipating operating expenses, and capital purchases. The anticipated total revenue is $1,823,900. Operating expenses include salaries, benefits, taxes, supplies, professional services, and marketing. Which a total calculation leaves a surplus of $1,305,888. A business plan must also be evaluated for success, as well as for adjustments that need to be made in order to maintain its success. A quality outcome that will be measured is the increased scores of patients who feel prepared to care for themselves at home. The importance of patients feeling able to care for themselves is tremendous, as they will be better able to maintain their health and further progression of their disease. Complications such as unhealing wounds, osteomyelitis, digit and limb amputations will be averted because they will be educated on the importance of medication compliance and healthy choices. Another quality outcome that will be measured is the patient experience through surveys provided to patients. The Diabetic and Wound Care Clinic will be able to address individual patient needs as opposed to the inpatient setting. Oftentimes, patients are admitted and discharged but are not sure on what lifestyle changes need to be made. Improved follow-up after discharge will ensure that patients are complying with doctor's orders. Providers will have more time to educate patients so they will not feel rushed when being seen. Not only are quality outcomes important, but financial outcomes are also crucial for the program. The costs must outweigh the benefits in order to demonstrate success of the program. Financial outcomes will be measured by a cost-benefit analysis. The average daily census of type 2 diabetes mellitus patients had notably increased from 24 to 31 patients. With the opening of the clinic and its ability to provide care and services for these patients, this number will ideally decrease from 31 to 24 or less within 6 months. This will result in significant cost decreases for the hospital, as inpatient admissions are costly. In addition, the review of readmission rates within 30 days of discharge indicated that readmissions had increased from 11 to 18%. Implementation of the outpatient clinic will ideally decrease the number to 11% or less over the course of 6 months. Reduction in these readmissions will prevent the hospital from incurring any penalties or decrease in funding that the hospital currently incurs. Success of the outpatient clinic also relies heavily on the marketing plan for the outpatient clinic. Marketing will be targeted towards those patients who have been identified to be diagnosed with diabetes and or require wound care. Patients who are being discharged from the inpatient setting will be referred to follow up in the clinic. Additionally, patients who have been diagnosed with type 2 diabetes mellitus and are seen by physicians in the network associated with AZRMC will be referred to the Diabetic and Wound Care Clinic. Here is a proposed marketing brochure for the clinic. Here we have a trifold brochure that will be available to patients seen either in their primary care physician's office or those who are newly diagnosed with diabetes coming from the inpatient setting. On the front it says we provide comprehensive care for those in the community, and that the newly designed Diabetic and Wound Care Clinic offers services for those who are diabetic or are in need of wound care services. We are proud to offer individualized care for the patients in our community. We are recognized by the community as a unique clinic where those with diabetes or wound care needs can receive individualized care and treatment. AZRMC is a leading healthcare provider in the community, and our state-of-the-art diabetic and wound care clinic is a leader in our region. Our team. AZRMC Diabetic and Wound Care Clinic staff is comprised of a team of nurse practitioners and nurses who work together with inpatient physicians, vascular surgeons, podiatrists, endocrinologists, orthopedic surgeons, physical therapists, and certified orthotists. Available services in our clinic are diabetes counseling, patient and family education, nurse practitioners and registered nurses, as well as personalized care and wound care. You may contact us at Azusa Regional Medical Center, and our telephone number is provided, as well as our email. Additionally, we also share our mission, vision, and values, which are to be a leader in patient-centered care, education, and healthcare services, to be recognized for patient care, education, and contributions to community health, and to be excellent community partners, establishing trusting relationships with our patients, and to provide culturally sensitive and respectful care. The proposed hospital-based outpatient diabetic and wound care clinic is beneficial for AZRMC by reducing inpatient hospital admissions and readmissions within 30 days, and the clinic provides residents of the community with preventive and ongoing care, as well as education regarding improved glucose control. Although there may be other clinics that treat patients with diabetes, the benefits for the hospital and the specialized care for these patients' wound care needs are crucial to our community. Because of the rate of increase in average daily census and readmissions, as well as the decrease in the patients who feel prepared to care for themselves at home, it is estimated that the average daily census and readmissions will continue to increase and further cause a decrease in those feeling ill-prepared to care for themselves at home. The approval of the Diabetic and Wound Care Clinic is strongly suggested, as it will reduce our operating costs, admissions and readmissions, and will provide better overall care for our community.